Hello everyone, welcome to the channel. On my previous video, I talked about our femoral nerve, obturator nerve and the fate of lumbar plexus. So if you have not seen that video, then click on the I button and watch that video now. Today I will talk about our fate of sacral plexus and very important nerve, sciatic nerve. Okay, so let's start from this photo. As you can see, this is photo of our sacral plexus. Suppose first of all, nerve 2 iliacus. Now this nerve supplies our inside of our pelvis. There is two muscles, one is iliacus, another is psoas. So this muscle supplies both of these muscle, I mean the ilio-psoas group of muscle. And the next one is our superior gluteal nerve. This superior gluteal nerve supplies our gluteus medius muscle, gluteus minimus muscle. Okay, it also supplies our piriformis muscle and tensor fascia lata. Okay, this tensor fascia lata presents this side, lateral position of thigh. Next comes our inferior gluteal nerve. This nerve only supplies our gluteus maximus muscle. Okay, then there is nerve to piriformis, which supplies only piriformis muscle. Now in our perineum, I mean inside of our pelvis area, there is two type of muscle. One is levator ani, another is coccygeus muscle. So this nerve to coccygeus and levator ani supplies these muscles. Okay, then comes our posterior cutaneous nerve of thigh. I mean this is the thigh and this is the posterior part. So skin area, you know, the cutaneous and skin are same terms. Okay, so posterior cutaneous nerve of thigh, it supplies the thigh part of, I mean skin of this thigh area, means posterior part. This pudendal nerve supplies our rest of the muscles present inside of our perineum, and it also supplies few organs are present inside of our perineum, and it supplies our external genitalia skin part, I mean the skin around the penis, skin around the vagina. Okay, next is our nerve to quadratus femoris and gemellus inferior muscle. So as you know already, this nerve supplies our gemellus inferior muscle and quadratus femoris. That's it. Next comes our nerve to obturator internus and gemellus superior muscle. By the name you can guess that this nerve supplies our gemellus superior muscle as well as obturator internus muscle. Okay, and the next comes our sciatic nerve. I already talked about in my earlier video of sacral plexus that how this sciatic nerve forms. So please watch that video if you have not seen that. Now I already told you that after the formation of sciatic nerve, this sciatic nerve goes downward, I mean the posterior compartment of our thigh. Now while it going downward up to the knee joint, it gives multiple branches. Suppose one branch supplies our semitendinosus muscle, another branch supplies our semimembranosus muscle, another nerve supplies our long head of biceps femoris, then another nerve supplies our short head of biceps femoris, then one nerve supplies our adductor magnus, I mean the posterior part of our adductor magnus. Adductor magnus muscle mainly presents in the medial part of our thigh. Few part presents, and in the medial part, few part presents anteromedially and few part presents posterior medially. Okay, so the branches are coming out from this sciatic nerve. It supplies the posterior medial part of adductor magnus. Okay, that's it. So ultimately this sciatic nerve supplies our hamstring group of muscle. Okay, there is a one fossa, it is known as popliteal fossa. Similarly at this our elbow position, there is one fossa. I said cubital fossa, and I already told about that. I will talk about this cubital fossa in future. Similarly, behind the knee joint, there is another fossa. We call it popliteal fossa. Okay, so I will talk about this popliteal fossa in future. Now, before it enters into the popliteal fossa, this sciatic nerve divides itself into two parts. One is common peroneal nerve, another is tibial nerve. Okay, now I'm going to talk about the tibial nerve. So as you can see in this photo, this is a photo of our tibial nerve. Now what I said that sciatic nerve before enters into our popliteal fossa, it divides itself into two parts. One is tibial, another is common peroneal nerve. Now I am talking about only tibial nerve. Now this tibial nerve presents in the popliteal fossa, and in the popliteal fossa it gives one branch, and this branch is known as sural nerve. I will talk about this later. Now in this leg, this tibial nerve gives multiple branches. Among them, these superficial branches are, it supplies our plantaris muscle, then it supplies our soleus muscle, then it supplies our gastrocnemius muscle. These are superficial branch. And in the deep, it supplies our popliteus muscle, then it supplies our flexor hallucis longus muscle, then it supplies our flexor digitorum longus muscle, then it supplies our tibialis posterior muscle. Okay, L4, L5, S1, S2, S3. This is the ultimate root value of our tibial nerve. I'm going to talk about our common peroneal nerve. Now you guys already know that in our leg there is two bone. One is tibia, another is fibula. Tibia presents medially, fibula presents laterally. Okay, now any muscle or nerve related with the fibula, we call it fibularis or peroneal. Now both words are similar. You can say fibularis or you can say peroneal, whatever you wish. I already told you that this sciatic nerve, before enters into popliteal fossa, it divides itself into two parts. One is tibial, another is common peroneal nerve. Now I already talked about tibial, so tibial is finished. Now I am talking about common peroneal nerve. What happens after after origin of common peroneal nerve above the popliteal fossa? This nerve goes laterally towards our lateral epicondyle of knee. Okay, now what happens, this nerve actually follows the medial border of short head of biceps femoris. Okay, and this short head presents laterally, so this nerve goes along with the short head and enters in our leg laterally of our fibula bone. Okay, in this position this common peroneal nerve divides itself into two parts. One is superficial peroneal nerve, another is deep peroneal nerve. Okay, you can also say this superficial fibular nerve or deep fibular nerve. Okay, so I say peroneal, so it will be better if you also say peroneal. Now this superficial peroneal nerve gives only two branches. One branch for fibularis longus muscle, another is for fibularis brevis muscle. Okay, both muscle presents lateral position of our leg. Now deep peroneal nerve, as already you can guess that deep means it remains deep position of our leg, and in deep position it supplies our extensor digitorum longus, extensor hallucis brevis and tibialis anterior. Now one thing I did not told you about the tibial nerve. What happens to this tibial nerve? It presents posteriorly, posterior part of our leg, and posterior part of our leg, and supplies our superficial group of muscles, deep group of muscles, and when it goes downward, it divides itself into two parts. One is medial plantar nerve, another is lateral plantar nerve. Both plantar nerve enters inside of our leg, at the sole area. Inside of this sole area, it supplies our every muscles of sole of our foot. There are four category muscles: first layer, second layer, third layer, fourth layer. All these layers I talked about in my muscles of feet. You can check those videos. My previous video and today's video, both video combined, I finished nerve supply of our lower limb. Okay, after completion of central nervous system, I completed today peripheral nervous system also. Everyone knows that peripheral nervous system combines two components. One is cranial nerves and spinal nerves. Cranial nerves I already completed in my earlier videos. So I already completed all spinal nerves video today. Now in our next video I will talk about our respiratory system. Okay, now I know that I did not talk about many important topics. I will cover in under special topics in future. Okay, see you in my next video with the respiratory system. Till then, bye.